At first glance, the companies you see behind me don't have anything to do with the pharmaceutical industry. But there actually is something that pharma can learn from them. I'll give you a moment to think about it. I'll come back to it later. Europe has a large pharmaceutical industry with pharma giants like Sanofi, Roche and GSK. And that's important because with a population of nearly 750 million people to take care of, it would be good to be self-sufficient. The reality, however, is that Europe has lost its position as a pharmaceutical superpower to Asia. Today, Europe is highly dependent on China and India, and that's a risky business for the entire European population. But how dependent is Europe really? And is there anything they can do to take back control? We'll cover that and more in this video. Hi there, my name is Ammar and I'm one of the founders of Pharmaoffer, which is a platform that connects buyers and sellers of APIs. Although we operate as a global platform, we are located in the Netherlands and we help out many medicine makers from Europe. APIs are the active ingredients of your medicine. You can say they are the most important part that has to do the work in your body. European manufacturers play a key role in the API market, representing 30% of global API production. That sounds very positive, right? Well, it actually doesn't say that much. The production of medicines is like cooking. Take an API, add some other ingredients for coloring, flavor or volume, and there you go, your medicine is ready. API itself, however, is way more complex to produce. APIs are produced in chemical processes. It's made out of one or multiple intermediates. These intermediates are made out of raw starting materials. And these raw starting materials are made out of raw materials. Are you still with me? If not, don't worry about it. All you have to remember is that we call this group of different types of raw materials API precursors. How dependent is Europe? Nearly all API producers worldwide source their API precursors in India and China. And so do API producers from Europe. European countries are 74% dependent on Asia, of which China is the most relevant country as it is responsible for almost 70% of the total Asian dependency. Let's take a look at these 5 large European countries. These are their top 10 most used molecules. For acetyl salicylic acid, they are less than 20% dependent on Asia, which is a relatively good number. But let's check out some other materials. You get a headache when you realize that if Asia cannot or doesn't want to supply paracetamol to Europe anymore, there would be no alternative at all. In case of shortages in the supply chain for these products, the impact would be dramatic. But has it always been like this? Well, no, actually. From superpower to weakest link. Back in the 70s and 80s, Europe was producing many of its own APIs and precursors. Most of them were produced in Italy, Spain and Portugal. Europe was only 30 to 40% dependent on other countries, whilst today it's almost 80%. It was due to constant pressure on the price of generic medicines that pushed medicine makers to use the cheapest APIs they could possibly find. These cheap APIs were bought in Asia or in Europe with Asian precursors. In the meantime, China took measures to improve their domestic and international supply of pharmaceutical ingredients, which we covered in another video. You should check it out if you want to learn more about it. Besides the price, there was a different climate for environmental awareness and safety regulations in Asia than there were in Europe, which created an uneven playing field for EU companies. It became nearly impossible to continue the European production of commercially interesting precursors with this competition. Why is this a problem? Each time a medicine is out of stock, patients need to change brand. If the formulation is a bit different, it can bring unpleasant side effects, or even worse, the medicine doesn't work for the patient at all. Besides, a change of brand is only a short-term solution, because when all brands are using the same precursors, it's just a matter of time before the alternative brand is out of stock as well. For many years, there wasn't a lot of attention for this problem. Most people didn't even know about this. But there have been several occasions that have shown how vulnerable the supply chain in Europe really is. For example, the infamous recalls of heparin in 2008 and valsartan in 2018. Or in case of political tension between China and Europe. The supply of pharmaceutical ingredients can be used as part of the negotiation. But the best example was the beginning of the COVID-19 pandemic. Wuhan, which is an important region for the production of APIs and precursors, was placed in lockdown. At that time, it wasn't clear if the lockdown would take a couple of weeks, months, or even longer. On our platform Pharmaoffer, we saw European medicine makers panicking by trying to stockpile their ingredients. Many suppliers were running out of stock, which forced buyers to change their source. Difficult to imagine they would try to buy up entire warehouses of stock, but hey, we consumers kinda did the same thing, right? What's the solution? IQVIA asked 52 relevant pharmaceutical companies and 71% of them were willing to invest in the European API supply chain if economic barriers could be overcome. According to this group, European suppliers score high on reliability and compliance. Price and manufacturing capacity, however, are barriers to selecting European sources over others. In their report, you find 3 main solutions recommended by this group of suppliers. First, take action on the level of the entire European Union by setting criteria to identify critical or strategic precursors and APIs, which should be based on therapeutic interest, regular shortages, vulnerability, like the number of alternatives outside Europe and Asia, and use of technology. Second, invest in European precursor plants that should have the highest environmental standards, so it's unlikely that it would be copied in Asia. Third, implement rules supporting European production. For example, tenders should include criteria other than just the price, such as the environmental impact. I agree with these suggestions, but I would like to mention another topic. When we started Pharmaoffer in 2016, we wanted to give medicine makers access to all qualified API suppliers. So when they wanted to buy from a European source, they were able to find and contact them. Compared to Asian companies, however, many European suppliers weren't interested in what we tried to accomplish with our digital solution. To be honest, I was expecting a more proactive and innovative mindset from them, which we saw at Asian companies. So, in order to be less dependent, European companies should be more open to innovation, if you ask me. So, what did you think the pharmaceutical industry could learn from these companies? Well, their products were produced at Chinese manufacturers for years, but they all shifted it back a couple of years ago to Europe because they were unsatisfied. A process that is called reshoring. A decision with impact on the cost of production, of course, but they have proven that it is possible. But who should take the first step in solving this European dependency problem? The European Union or the pharma industry? Let me know what you think in the comments below. Thanks for watching. Please subscribe to our channel if you want to see more pharma content like this. Greetings.